I'm Dr. Pierre Lapaine. I'm the newest surgeon here at Neinstein Plastic Surgery. I'm going to be doing all breast and body procedures, but one of the areas where I specialize is high definition liposuction. So I wanted to take this opportunity to tell you a little bit more about what that is and if you might be a good candidate for it. So the first question is, what is high definition liposuction? So typically liposuction is we are removing fat with a cannula that kind of looks like a metal straw like this. And the traditional way of doing it is we're really going for a smooth, even contour. High definition liposuction is the new way of doing it in the right patients, and what that is we're really trying to create a very athletic appearance and really define the muscles that you've been working hard on at the gym. So typically the HD lipo is done in 3 stages. So the first part, after we put in all the numbing fluid, is that we melt the fat with an ultrasound technology called Vaser. And so that's this probe right here, and this goes in, and using that ultrasound, it really helps separate all the fat and really helps create a nice even contour, and so that we can extract the fat as naturally and as easily as possible. The next step is to actually remove the fat, and so like I showed before, it's done with this kind of cannula, and this helps suck out that fat and remove the fat cells permanently from the area. The third step is skin tightening, and that is done with Renuvion. Now this creates a plasma energy, and effectively it creates a shrink wrap effect underneath the skin and causes all the soft tissues to contract. This is to try and minimize the risk of any skin laxity and really bring those results to the next level. One of the common questions I get is, who is the best candidate? So this is not a procedure for people that have a lot of loose skin or that have a lot of weight to lose. This is for people that have already put in the work, lost the weight, have the muscle bulk there, but just can't quite get that definition that they want. And so this is that final mile to really take them over the edge and give them that sharp, defined athletic look that they've been trying to get. So some of the details about the procedure, typically depending on how much fat there is to remove and the patient, it's somewhere between 1.5 and 3 hours long. Typically we do this with general anesthesia. It can in some cases be done awake with local anesthetic, and that's a discussion we can have at your consultation and what option might be best for you. The results themselves should last a very long time, but like anything, it's very important to maintain a healthy lifestyle with diet, exercise to try and maintain that so that you're not gaining weight and potentially not keeping that sharp definition that we've created. Recovery after the procedure typically is about 2 weeks. Now the first week is definitely the hardest. You will be in more pain. You really can't plan to do a whole lot. By the end of 2 weeks, you should be able to function day to day. However, there will still be a significant amount of swelling, and that swelling can take 3, 6, or even more months to completely go away. So really the results will start to be seen at 3 months and when they're really coming in, but it's a year until you're at the final result. So the last common question that we get with this procedure is, will it look fake? Now the whole idea of this is that we have to, 1, choose the right patients, and then 2, follow your anatomy. The whole point of this is to actually find and define your natural muscles so that nothing is fake. We're not creating fake muscles. That's not the goal of this. We are really trying to show the muscle you already have that you just haven't quite been able to define yourself in the gym. If this is a procedure that sounds interesting to you, I would love to meet with you, discuss your goals, and have a consultation. You can do that by calling the office or emailing info@neinsteinplasticsurgery.com, or check me out on Instagram, send me a message. My Instagram handle is Pierre Lapaine MD, and I would love to chat with you more and see if this is right for you.